My name is Abigail Caleb. I am the Senior Technical Officer for Food Security and Nutrition at CARFA, and I am delighted to be your moderator for today's webinar. We have with us today an expert panel that will present on the situation of chronic diseases, particularly diabetes in the Caribbean, as well as support and management mechanisms in place. These are the topics that will be covered during today's webinar. Presentations will be followed by a question and answer segment where we would love to hear from you, the audience. Please place your questions in the Q&A function, which can be found at the bottom of your screen. This webinar is also going to be live streamed on YouTube. For those of you joining us on YouTube, you can place your questions in the comments section and they will be addressed in this session. At this moment, I would like to invite you to listen to a recording bringing opening remarks from our Executive Director at CARFA, Dr. Joy St. John. Your recording, please.
Thank you, Madam Moderator and Senior Technical Officer for Food Security and Nutrition. Ms. Abigail Caleb of CARFA. Ms. Camille Guijanet, Project Officer and Regional Communication Manager for Agence Française de Développement, AFD. Dr. Gloria Giraldo, Advisor, Non-Communicable Diseases and Mental Health of the Pan American Health Organization, PAHO WHO. Dr. Heather Armstrong, Head Chronic Disease and Injury Department of CARFA. Ms. Maisha Hutton, Executive Director of the Healthy Caribbean Coalition. Dr. Fabio Gomes, Advisor, Nutrition and Physical Activity of PAHO WHO. CARFA staff, participants. Good morning. Have you ever heard the saying, you are what you eat? So this morning, what are you? I will share. I am callaloo soup. Suppose we ask the CARICOM region. 20, 30 years ago, the answer would have been cuckoo and steamed flying fish, ackee and saltfish, ground provisions, washed down with homemade lemonade. Nowadays, the answer is macaroni pie, fried chicken and greasy chips. From a variety of fast food franchises, washed down with a carbonated beverage liberally sweetened with sugar. What happened to us? Decades ago, the Caribbean produced fresh fruits and vegetables, and boats made sure that small farmers had markets up and down the islands. We cooked and baked some of the tastiest and most nutritious food anywhere in the world, known for its unique blend of herbs and spices to match the melting pot of cultural epigastric delights brought into the Caribbean by our ancestors from distant lands. Now, our region imports a lot of our food, more than 60% in some countries. And so our populations are overexposed to more sugar, fat, and salt than is recommended for healthy living. We also choose more prepared meals, often from fast food franchises that are high in sugar, fat, and salt. In this post-pandemic era, supply chains for food are weak and sometimes broken. So our region is faced with food insecurity of less nutritious food. Is it any wonder that in CARICOM, we are in a battle with the scourge of this non-communicable disease burden? Because we are what we eat. The epidemiology has not improved. We have several of our sister islands classified as having the highest NCD prevalence in the region of the Americas. As non-communicable diseases are the leading causes of premature mortality, morbidity, and disability in the Caribbean region, there is also a high economic burden, and the countries are less productive. Our children are overweight, obese, and primed to develop diabetes, hypertension earlier than previous populations. Even worse, we watched as COVID-19 seemed to target those among us with diabetes and hypertension for severe illness and death. For persons with diabetes, all types, the disease can be effectively managed with a regimen of drug therapy and lifestyle management. Included in this is the foundation of healthy diet and age-appropriate exercise. Therefore, in 2019, to strengthen and standardize the management of diabetes in primary care in the Caribbean, CARFA launched an updated version of the CARFA guidelines for the management of diabetes in primary care in the Caribbean. The clinical guidelines are presented in 5 modules. To ascertain precisely how to assist our member states to effectively implement the nutrition component of these guidelines, in September to October of 2022, CARFA conducted the initiative Needs Assessment of Nutrition Services and Support Tools for the dissemination of the nutritional management of the CARFA guidelines on the management of diabetes in primary care in the Caribbean. The needs assessment study was conducted in 10 member states. The results revealed that there was limited human resource capacity to counsel and provide nutrition services to persons with diabetes, a paucity of trained nutrition and dietetic professionals, as well as a lack of standardized nutritional support tools for the implementation of the nutrition component of the CARFA clinical guidelines. Our research identified the gaps. CARFA then developed nutritional tools to address the gaps and support the dissemination of the CARFA guidelines for the management of diabetes in primary care in the Caribbean. Our theme tells the story of this process: standardizing nutritional management of diabetes mellitus in the Caribbean region. Launch of Diabetes Nutrition Management Toolkit. So we are here. The tools were developed using the guidelines, best practices, and in consultation with nutrition and dietetic experts and other professionals in the region. Some tools specifically target the healthcare professionals involved in the management of people with diabetes, while other tools are meant for the people with diabetes and their caregivers. Together, the 6 tools comprise the Diabetes Nutritional Management Toolkit. First one is a booklet, Managing Diabetes Mellitus, a care guide for persons with diabetes. Second one is also a booklet, Nutritional Management for Persons Living with Diabetes, Healthcare Professionals Guide. Third one is a poster, My Caribbean Plate. Fourth one is also a poster, Managing My Diabetes. The fifth one is also a poster, Nutrition Labels Made Simple. And the sixth one is a handout, Healthy Eating with Diabetes, with tips and recipes. I'm always excited to be part of events like this when it is clear that we collectively make strides towards achieving the goals set out by the leaders in the historic Port of Spain Declaration decades ago. Every step brings us closer to the goal. I extend sincere thanks and appreciation to l'Agence Française de Développement through the CARFA-led project, strengthening strategic intelligence and partnership approaches to prevent and control NCDs and strengthen regional health security in the Caribbean for funding this initiative. I also want to thank Dr. Armstrong, Ms. Caleb, and those officers in CARFA and our stakeholders for the work that led us to this webinar. These tools are really very practical, and I hope you can help save the lives of our Caribbean people by using them in your practice and sharing with your colleagues and those who are living with diabetes. I thank you.
Thank you very much, Dr. St. John. Even though Dr. St. John could not be with us today, she took the time to record those opening remarks for us. Thank you very much. Now, if you'll please allow me to invite Ms. Camille Guigonet, who is the Project Officer and Regional Communications Manager of l'Agence Française de Développement, AFD, to give remarks.
Thank you, Madam Moderator. Yes, thank you very much. So dear Dr. Joyce and John, even though you are not here, colleagues from CARFA, colleagues from the Pan-American Health Organization, the Healthy Caribbean Coalition, from the regional and national associations for diabetes and for nutrition and dietetics, and from the Caribbean region health sector at large, dear all. I'm very grateful to be here today representing AFD, the Agence Française de Développement, at the launch of the Diabetes Nutritional Management Toolkit developed by CARFA. The Agence Française de Développement Group implements France's sustainable development and international solidarity policies. AFD is in charge of public sector and NGO financing, research and training. We finance, support and accelerate the transitions required for a fairer, more resilient world. Based in Martinique, the Atlantic Ocean Regional Office operates in 16 Caribbean territories to promote regional development by bringing territories together and improving living conditions for populations. Our institution has supported CARFA since 2019 in the framework of two projects. The DIRECT project, which aims to improve integrated digital public health surveillance in the Caribbean, and a second project aimed at strengthening strategic intelligence and partnership approaches to prevent and control NCDs and strengthen regional health security in the Caribbean, as mentioned previously by Dr. Joyce and Joy. The second project, which closes in September, has supported CARFA in its objectives of strengthening regional health security and coordination capacities in relation to regional public health priorities and crises linked to the effects of climate change, particularly in the fields of vector-borne diseases. The projects also facilitated CARFA's work in increasing awareness, evidence and advocacy for the implementation of regional guidelines for the prevention and control of non-communicable diseases in primary health care, especially diabetes and hypertension, through a range of initiatives including webinars, various communication initiatives, and the dissemination of information and decision-making tools. The portfolio of tools also includes this nutrition toolkit, which brings us together today. The nutritional guides for persons living with diabetes and healthcare professionals designed in the framework of the CARFA and AFD project, are tangible evidence of our successful partnership. We are pleased that not only will it contribute to counseling and providing nutrition services to persons with diabetes, it will also deliver new efficient management tools for dietetic experts and other professionals in the regions. I wish you an enriching webinar. Thank you very much.
Thank you very much, Ms. Guéchenet, for bringing those remarks on behalf of AFD. And now I would like to invite Dr. Gloria Giraldo, who is the advisor for non-communicable diseases and mental health at the Pan American Health Organization, PAHO, to bring remarks on behalf of PAHO. Dr. Giraldo.
Thank you. Good morning, colleagues. All protocols have been duly observed by Dr. St. John. It is my pleasure to bring you greetings on behalf of the Pan American Health Organization and sub-regional program in the Caribbean to this important launch of the CARFA Diabetes Nutritional Management Toolkit. I'm pleased to join you today and salute all of you, the 14 of you that are joining. And I know that many of you work directly day to day with persons with diabetes, or some of you are a person with diabetes yourself or a caretaker. We're all too familiar with the population level data. And as it was just said by Dr. St. John, diabetes is among the non-communicable diseases that constitute the leading causes of death and disability in the Caribbean. We know that among the countries with the highest age standardized death rates due to diabetes, 5 among the top 7 are from the Caribbean. Some people often have to face more than one condition, such as hypertension and diabetes. And furthermore, we painfully learned that people living with diabetes have a higher risk of developing severe COVID-19 symptoms. We're also aware of the devastating costs of NCDs for our societies in terms of health, well-being, and economic development. PAHO has been engaged in conducting cases for investment in the prevention and control of NCDs in Jamaica, Suriname, and now Guyana, demonstrating that there is a clear opportunity to reduce the burden of NCDs to preventative and management actions, adoption of the WHO best buys, which are cost-effective interventions, and which diabetes management and through nutritional management is one of them. And it has been demonstrated the high return on investment resulting from the implementation of this evidence-informed and based interventions to curb the prevalence of NCDs. Tackling NCDs in our region is a major challenge. And part of the solution lies in effective collaboration, like we're doing today, training and effective evidence-based practice guidelines, like the ones you've developed. It also involves a 3-pronged approach. 1, implementing public policy that directly addresses risk factors, including through legislation, regulation, and helpful economic incentives. 2, building capacity of the committed health workforce. And if 500 people showing up to this launch is not proof of that commitment, I'm not sure what would show that. So this is great participation. And 3, empowering individuals to make healthy and informed decisions about personal behavior within supportive environments. Fortunately, the momentum gained by leading organizations such as CARFA, with the supportive partners such as l'Agence Française de Développement, as well as academics, practitioners, have resulted in the important diabetes nutritional management toolkit that is being launched today. It will be a significant part of the comprehensive CARFA guidelines on the management of diabetes in primary healthcare, as it was described by Dr. St. John. The launch of the Nutritional Management Toolkit aligns very well with the WHO Global Diabetes Compact and our regional PAHO implementation of the compact, which urge member states to intensify, where appropriate, efforts to address the prevention and control of diabetes as a public health problem as part of universal health coverage by advancing comprehensive approaches on prevention, management, including its complications and integrated service delivery, while emphasizing the importance of early childhood prevention. The WHO Global Diabetes Compact was created as a global initiative to improve diabetes prevention and care, and to contribute to the global targets to reduce premature mortality due to NCDs by 1/3 by 2030. I am certain that everyone is eager to learn together about this new wonderful toolkit. I wish you a very productive launch, and I look forward to upcoming information exchanges, training sessions, and further collaboration. The NCD crisis affecting our region make this training both timely and critical. Congratulations to all of you that worked so hard, but here you can see the fruit of your labor, but by this very, very encouraging turnout of professionals from the region. Thank you very much.
Thank you very much, Dr. Giraldo, for those rousing remarks. And though there are currently 511 persons in this room, in this Zoom meeting, we have even more who are accessing it or viewing it via our live stream on YouTube. So please do not be discouraged if you're not able to join in on the Zoom session. You can also join us on YouTube. And we will now begin our panel discussion. Our first panelist is Dr. Fabio de Silva Gomez, who is the advisor for nutrition and physical activity at PAHO. Dr. Gomez.
Thank you. Thank you very much for the invitation, for this opportunity. I'm going to start sharing my screen to share some slides. Hope you can let me put those.
We're seeing the slides and the presenter view.
Now it worked.
Yes, it happened.
So I think we wanted to start making the point on how relevant and how important it is for us to tackle NCDs, and how nutrition is an important factor in resolving such problems. As we know that in the Caribbean, 3 out of 4 people die from NCDs when we're looking into the different causes. But not only the fact that they are dying from these diseases, but also that these deaths in their majority are premature deaths, meaning we're losing life with quality that could be enjoyed by the population for many longer years, let's say. And what we can estimate, even if we go further and look into the main risk factors that are associated with the major NCDs, including diabetes, you see that almost half of the deaths were caused just by these factors that are intimately linked with inadequate nutrition. And we can also estimate that for the Caribbean in 2019, we saw 20 deaths per hour just caused by these 3 risk factors. And these resulted in a loss of lives with quality in the region. Just in that year, that accumulates almost 5 million of years that was lost, summing the years that people lost due to the diseases, even if because they were in a hospital or at home, they couldn't work, they couldn't play, they couldn't enjoy life the best way they could, or they died prematurely, so they couldn't enjoy the extension of life in their full potential. And we know from the evidence how excess weight, overweight, obesity, physical inactivity, but mainly the inadequate diets will impact in the major 3 NCDs, diabetes, cardiovascular diseases, and cancers. And the evidence is really clear on that. And it's important for us not only to learn about the causes. So we know that obesity is one of the major causes. And we also know that the Caribbean has one of the highest rates, and actually the country with the highest rate of obesity, prevalence of obesity, overweight and obesity in adults in the world is located in the Caribbean. So we actually have the region with the highest prevalence of overweight and obesity worldwide. But more important than knowing that is knowing that these causes, they also have causers, so that we can go into looking into the solutions, so we can find ways to remove those causal effects and causes of those causes. So we'll always need to go down to where we need to intervene so we can solve the problem. And we know there's a series of products, practices, and policies that bring a transformation into the food systems and the diet of the population, and have been changing this dramatically, as Dr. Sanjoy mentioned at the beginning during the opening. And I'll start with the beginning of life, and how we treat our children, our babies, our infants, and how this breastfeeding is super important for the prevention of NCDs at the long term and within the life course. So we know from systematic reviews that have been done several times that breastfeeding not only protects children against overweight and obesity, but also protect the adults that were breastfed when they were children, when they were infants, from overweight. The same happens for hypertension. This is on the right. We have systolic blood pressure. So if we look into adults that were breastfed, so if we follow them in cohort studies, we'll find that they have a protection against hypertension that is also a contribution from breastfeeding. So there's a long list of benefits for children. And of course, the first ones should be known were the shorter ones, the protection against diarrhea, respiratory infections, so otitis, sudden death, but also increasing and now robust evidence on medium long-term effects that includes the protection for overweight, obesity, and diabetes in the long term, as well as malocclusion, which is also important for nutrition and for all the other elements of that we're speaking of. And then also a protection for mothers, which is important for topic that we're dealing with today. So we're protecting children during childhood and as they go into adulthood, but also protecting mothers from breast cancer, cervical cancer, overweight, and diabetes when they breastfeed their child. That brings a benefit that is not only health benefits, but also a development benefit, as it saves billions of US dollars worldwide as we reach a universal, if we were to reach a universal breastfeeding. The situation in our region is that we still are have just a little bit less than around 1/3 of our child are exclusively breastfed until the 6 months of age, which really lower than what we would like to have, so we can give them the best start, also to prevent NCDs in the region. The other, and then going back to the cause, but why we're not reaching exclusive breastfeeding, so we have always go to the causes and to the causes of the causes, and we'll come arrive at the ultra processed products, where we see in countries in our region. This is an analysis done with 14 countries, ecological analysis, that shows the more ultra processed products you see being sold in the countries, the higher the prevalence of obesity in adults. And I'll also show how these affects as well breastfeeding and the early start of complementary feeding. So the more ultra processed products we have in the diets of the children, and also of the mothers, the lower is the continuation of breastfeeding between 6 and 24 months. So that's where it affects the complementary feeding that should be protected from these ultra processed products. The same if we introduce ultra processed products for children with 24 months, we'll have higher intakes of saturated fat, sugars, and sodium already at that age, and also lower consumption of fruits and vegetables among that age group. And also, if we increase the ultra processed products among the mothers, what we see is a higher amount of and a higher frequency of introduction of ultra processed products in the complementary feeding of their children. So it's really important for us to see how ultra processed products are penetrating both the diets of the child and also of the mothers, and then that is affecting the child at the latest. And we know that in terms of nutrition, the more ultra processed products we have, the more energy, the higher is the energy intake, the energy density, the amount of sugars consumed, total fats, saturated fats, trans fats. And also, this comes with a reduction in fiber, vitamins, minerals, protein, and nutrients that are essential. It is being shown everywhere in the world. There's no place in the world where people eat more ultra-processed products and their diet has a better quality. So the more ultra-processed products we have in the diet of the population, the worse is the quality of the diet. And just this has also been demonstrated in the Caribbean. This is a study from Barbados, just showing how you compare the diet of those eating ultra-processed products and those not eating ultra-processed products, and having a diet more based on real meals and real food. And you see the ultra-processed fraction of the diet having 6 times more sugars than the ones that are not consuming ultra-processed products. And that amount of sugar is triple the recommendation of WHO for the restriction in terms of free sugars. And an important message for us also today for the prevention of diabetes. And then not only we have an impact on the diet, so the diet is completely distorted when we're having ultra-processed products penetrating our diets and food systems, but also this has also been shown now to affect health. So these are systematic reviews and meta-analysis that show the ultra-processed foods intake are associated with all-cause mortality, cerebrovascular diseases, cardiovascular diseases, depression, overweight, and obesity. The many cohort studies that also shown how they increase these by following populations cohort studies for long periods and large cohort studies in different countries. We have examples from the UK and Spain, how the replacement of ultra-processed products with unprocessed or minimally processed foods could reduce our risk of mortality, and how the increase of ultra-processed product would increase our risks. And this goes all the way to randomized controlled trials that demonstrated if you give the same amount of calories, you match sugar, you match fat, fiber, micronutrients, everything, but you give a group all those amounts in ultra-processed form and the others in unprocessed form of a diet, and you see the ones eating ultra-processed having increasing body weight, having more kilocalories at the end of the day. And this was just 14 days trial with patients that they could only eat one or the other profile of diet, and this being very, very clear, the results that how ultra-processed products leverage body weight and also energy intake. And there's all the other effects that include changes to our microbiota. Sorry, it's going back. That also demonstrates that the more ultra-processed we have, even if we have a low energy diet, but it's fully comprised by ultra-processed products, this will generate dysbiosis, so unbalance our microbiota, which is really important for our immunological system and also for NCD development. So it puts our whole body in a more vulnerable state, let's say. And then now going to the final part of the presentation, just in closing, how we've seen that the causes of the problem really relate on the fact that if we keep our markets deregulated, and that's what we find in the Caribbean today, if you're not regulating ultra-processed products, we're just going to have more and more ultra-processed products in our countries, and more distortion of our diets and more diseases associated with that. So we need regulation to apply labeling, marketing, taxation, and also change settings, including school settings and other settings, so we can redesign the food systems and that for us to identify the products that need to be regulated, we have developed the Nutrient Profile model, which allow countries to identify which products should be subject to those regulations. And have seen and looking into the diets of more than 125,000 people in 9 countries, including populations from the Caribbean, that if we apply policies with these criteria, we will reduce the proportion. We will help populations meet the WHO intake goals, because these products are the ones that are raising their diets to higher levels than the recommended by WHO. So in terms of best practices, we know the front of pack warning labels are the ones that perform best, as they allow a quick, easy identification. They're more relevant, they're more useful, they're more effective in changing decision and purchase of products. This has also been demonstrated in the Caribbean, where we see the octagon warning labels changing and improving the correct identification of the least harmful option when deciding for a product, correct understanding about the nutritional content of the products, and also changing the intention to purchase these products. And also just it's really important to highlight how the Caribbean is also the largest, has the highest consumption of sugar sweetened beverages in the world, and that also means that we need to advance in the application of taxation of sugar sweetened beverages. We have some Caribbean countries that already have taxation of sugar sweetened beverages, but there's still, the share of those taxes are still very low. Most countries have less than 10% of the tax share applied to sugar sweetened beverages. And finally, elements of the policy making that are really important for us to prevent preventable NCDs, such as the removal of elimination of industrially produced trans fatty acids, which has been adopted in many countries now, and the Caribbean still to take that approach. So it's something that we need to advance. And have restrictions for the sodium content of products. And we've also launched the regional sodium reduction targets for countries to adopt, and define that products that go beyond those thresholds should no longer exist in the market. Trying to reshape the food system so we can facilitate a healthier diet for the population. Finally, it's not only about the evidence, it's about the rights of the people. And as the UN Special Rapporteur on Health has mentioned, and that's also been endorsed by other special rapporteurs, such as the one on right to food and the ones on human rights transnational corporations, it's important within the framework of the right to health to highlight that the states are required to adopt regulatory measures to tackle NCDs. That's the only way we can reshape the food system in a way so we can go back to the real food we need, the breastfeeding, preparation of food, and food system that can supply and produce foods in a healthy and sustainable way. Thank you very much.
Wow, very interesting presentation, Dr. Gomez. Thank you for that. Now, with the burden of chronic diseases being so high in the Caribbean, in no small part to the unhealthy food environments, as was so brilliantly highlighted during Dr. Gomez's presentation, what are the control mechanisms in place? Our next panelist is going to present on a set of clinical guidelines, which, if implemented, is going to help to standardize the management of diabetes across the region. Please allow me to introduce Dr. Heather Armstrong, who is the head of the Chronic Diseases and Injury Department at CARFA. Our presentation will be an overview of the CARFA guidelines for the management of diabetes in primary care in the Caribbean. Dr. Armstrong.
Thank you so much, Caleb. And I will now share the presentation. And as indicated, we are going through a brief presentation that will share with you the guidelines, diabetes guidelines, which was the basis for the Nutritional Management Toolkit. And at the end of it, we'll be able to, talk about and discuss the aim of the guidelines, identify the target audience for the guideline modules, and of course, be able to identify the topics covered under each module. With regards to the burden of disease related to diabetes, we've had several presentations that reminded us that we are certainly under threat from diabetes and other nutritionally related NCDs. And with regards to Caribbean diabetes guidelines, from as early as 1995, the region has had some guidelines produced to help guide the process of being able to address diabetes at the clinical level. And this also included guidelines on how we should manage diabetes from a nutritional perspective. But despite the ability to produce these guidelines over the years, it was noted that there was still some deficit with regards to what was happening with the cascade of care and the outcomes that were experienced by patients who were living with diabetes. And so with the collaboration of the OECS, CARFA was able to update the guidelines. And obviously, it was made sure that we were in alignment with the WHO HARPS program and the WHO's package of essential NCD interventions. Several persons contributed and worked on the guidelines, making sure that we had a wide perspective from all disciplines, and of course, making sure that we also had persons who have the experience of living with diabetes. Several key guidelines were adhered to, making sure that it was evidence-based, culturally relevant, that it was cost-effective, and of course, that the guidelines were not too complicated, that the individuals who had to work with the material found it too complex. Even doctors could understand. At the center was the patient, making sure that the patient was informed, because we know with informed patients, they are more activated to implement the changes within their lifestyle. And with the healthcare professional prepared, then there are interactive sessions that lead to good outcomes for the patient. Other key important factors is that the care should be team-based and it should be proactive. So again, we see the thought that the client is at the center of everything we're doing with regards to improving the outcome for persons living with diabetes, and that is a multidisciplinary approach. So let's talk more of the modules that are found within the particular guidelines. And as you can see, we had a modular approach where each module builds on the one previously. So module 1 was the evidence-based treatment protocols for diabetes. And as noted, the aim was to provide updated algorithms that could be incorporated in the care provided by health professionals to those working with persons with diabetes. And therefore, the audience reflected the material that is found within this particular module. And as we can see, again, we wanted to highlight the importance of having a multidisciplinary approach, but also noting that as you engage with the client, that is important to understand the client as a whole, as opposed to just trying to treat the diabetes. You need to treat the client. And therefore, the topics covered reflect this interaction between the healthcare provider and the person living with diabetes. For module 2, we then went the next step in terms of looking at healthy lifestyle counseling. As you note, diabetes is one of the main nutritionally related NCDs, and therefore it was important to address diet, physical activity, weight management, and the mental health of persons living with diabetes. And as you can see, the audience for this particular module widens as it goes beyond the healthcare providers to also include home health and community aids. The topics again reflect the aim of the module in that we look at supporting lifestyle changes. We provide information that persons can then assist them with their self-management, but we also touch on the role of the healthcare provider in helping the changes that need to occur so that the outcomes can be improved. So let's talk about module 3. And as you know, module 3 then focuses on the persons living with diabetes and the caregivers. And with this module, we wanted to inform persons living with diabetes and the caregivers about what is involved in the whole aspect of medical and care and other things are important for them in terms of being able to manage or to improve what's happening with their diabetes. So we touched on topics such as blood sugar control and risk factors for diabetes. We also talked about what to expect from your doctor's visit, because we want activated, involved patients or clients, as a better word to use. And we also talk about setting lifestyle change goals. If you want to improve something, you have to have goals and you have to have a pathway to lead you to success. So these are some of the things that are covered under this particular module. With module 4, we note that, yes, we have lifestyle change, but one of the things that we have to make sure that is available and that is essential medicines. So module 4 looks at all of the factors that need to be taken into account when we have medications for the management of diabetes. What do physicians, nurses, and pharmacists and personnel involved in the healthcare system need to be aware of to make sure that there's access to these essential medicines? And therefore, this module covers 3 big areas: medicines used in the treatment of diabetes. It then talks about this access to essential medicines and covers the whole concept of supply chain management. So we now come to module 5. We've touched on the evidence-based treatment. We looked at healthy lifestyle counseling. We also touched on resources for persons living with diabetes and their caregivers, and then access to essential medicines. Module 5 then brings to our attention that there needs to be systems for monitoring. With all the work that we have to do to improve the outcomes for persons living with diabetes and individuals involved in helping those individuals to obtain optimal health, there needs to be systems for monitoring. And therefore, this particular module then is here to assist with the monitoring and reporting information on the prevention and management of type 2 diabetes. And of course, looking at the implementation of the guidelines using these standardized indicators and data collection tools. Noted, it then provides some information on how do you choose your indicators. It also broaches the topic of models of record keeping, and then data collection and reporting tools. So it covers all of the areas that are important for monitoring and evaluation of the implementation of the guidelines. This particular chart just then gives, in summary, all that I have said before in terms of the modules that are available, the areas that are covered, and then who the target users are. Within the modules and within the guidelines, you would find that there are several helpful charts that help to bring information or highlight information that's important in the management of type 2 diabetes. And as you can see, we have information here on the risk factor for body mass index and waist circumference, highlighting that with ethnicity, these are a factor that we should take into account when we look at this particular component. Again, within the module, you'll see type 2 diabetes risk assessment form. So there are individuals who may not have the symptoms related to type 2 diabetes, but with this particular form, you can do assessment to identify how high their risk is with the development of diabetes within a 10-year span. So to access these guidelines, you can go online on the CARFA website, and you're able then to access the clinical guidelines modules 1 to 5. You're also able to access a pocket guide, which summarizes the information from these guidelines. And then there's also available the algorithms and other charts that will be important for use with the guidelines. I just want to leave with you this thought that diabetes, living with diabetes is a journey. It's important to try and try again. But with the help of the resources that are provided, this journey can be made easier. Thank you.
Thank you very much, Dr. Armstrong. Thank you for presenting on those 5 clinical modules of diabetes management that were developed by CARFA. Our next presentation will also focus on control mechanisms in place, not from the clinical standpoint, but from the civil society perspective. Ms. Maisha Hutton, who is the Executive Director of the Healthy Caribbean Coalition, will now present on diabetes support groups in the Caribbean. Ms. Hutton?
Thank you, Ms. Caleb. First of all, I'd like to congratulate CARFA for the launch of this new toolkit. It's excellent, and we welcome this. My name is Maisha, as Ms. Caleb has said, and I'm delighted to have been invited to share on this webinar the role of civil society organizations in supporting diabetes management, specifically with a focus on nutrition management.
You're muted, Maisha.
I was muted, I just realized, sorry about that. Thank you again for inviting us to speak at this webinar today. We are delighted and like to congratulate CARFA for the launch of this toolkit, which is incredibly important for particularly the diabetes NGO community. We're speaking today from the perspective of support groups and really welcome the nutritional management component. HCC is a civil society organization. We represent civil society organizations across the region, including diabetes associations. And we also do quite a bit of work around advocacy, and the advocacy really ties into a lot of the policies that we heard Dr. Gomez speak about in terms of preventing diabetes through modifying the food environment. And then on the clinical treatment side, we advocate for prevention, for treatment as well, and the implementation of guidelines. So we're really happy to see these guidelines being launched today. In preparation for this meeting, we reached out to our membership and we asked them a few questions about support groups and the role they play within the context of nutritional management. Many of them say that they currently use the CARFA guidelines in addition to other guidelines. They have support groups, and the support groups suffer with some challenges. Many of them have limited capacity to address nutritional management. They may have challenges around in-house nutritionists and dietitians. There are also financial investment challenges around tools that they need to support their members. There's also a need for culturally tailored guidance, which is why I think the nutritional guidelines from CARFA are so important. Having looked at some of the images and glanced at the tools so far, we're seeing local foods there, which will help the organizations to work with their members with local foods. And then they talked about the environments, which are really up against their members. How do people who are diabetic deal with environments that are highly obesogenic? And they expressed interest in these new CARFA toolkit and welcome the opportunity to use them and provide feedback. As part of the presentation today, we really wanted you to hear from our members on the ground. So I'm going to invite two of our members, Ms. Juanita James, who is the president of the Antigua and Barbuda Diabetes Association, to share some experiences from Antigua. And then following her, Mr. Andrew Danu, who is the president of the Diabetes Association of Trinidad and Tobago, will also share his experiences and perspectives on this toolkit. So I'm going to hand over now to Ms. Juanita James. Ms. James.
Thank you, Maisha, and thanks for the opportunity for sharing today. So in our association, Antigua and Barbuda Diabetes Association, we do include, of course, nutrition education as an integral part of our education program. We offer group sessions as well as individual counseling. We are fortunate to have several of our members who are registered dietitians and nutritionists, and we work with other nutrition professionals within the Ministry of Health, in the hospital, and in our national association. We also have some of our dietitians who are now being trained to become certified diabetes educators. I'm not saying that we have all the human resources we need, but we certainly have seen an improvement over the years. Our emphasis is on healthy eating for the entire family, really, and we place the person living with diabetes in that context. So we use our national food-based dietary guidelines to encourage the consumption of a variety of healthy foods, and certainly including our local foods for the whole family. There is always that concern that persons who have a diagnosis of diabetes have the perception that they will never be able to enjoy the foods they like. They can't use foods that are culturally, they're familiar with. And we certainly work towards trying to dispel that myth and to encourage the use of a variety of foods in appropriate amounts and combinations. We do use the healthy plate, the ADA healthy plate, and some of our dietitians have more recently been trained on the CARFA guidelines as well. In all settings, we try to be very practical with the use of food models as well as real foods to demonstrate what healthy eating should look like, and food portion sizes, carbohydrate counting, etc. Timing of meals, and also in relation to exercise, medication, and individual schedules, self-monitoring so they can see the effect of the food. Some of the challenges we face, human resource, of course, but there's a lot of misinformation and conflicting messages even from the healthcare team. And certainly the importance of working as a healthcare team with the focus being on the person living with diabetes is really quite critical. The cost of food is another great challenge. And people, of course, are looking for convenience, and a lot of persons are eating out. So we have to take those into consideration. I think it's important for us to have standards that we can be guided by, but for us to also be practical and to start with where people are, moving towards our goals, to include the family, and to be consistent and to be sending out one message, not that a member of the health care team is saying you can't eat mangoes or you can't eat green bananas, and you're getting different messages from different sources. So we look forward to using this tool and certainly getting a closer look at the resources that are being offered here. Thank you.
Thank you, Juanita. And now over to Andrew Danu.
Thank you very much, Maisha. And I want to echo your comments and congratulate CAFA for compiling these tools. Of course, they are going to be very useful for diabetes associations like ours in Trinidad and Tobago, and of course, other organizations across the Caribbean. I want to also say that for just like Juanita, we have been using the previous CAFA tools, and we've also been using tools from the International Diabetes Federation and the American Diabetes Association. So I'm going to just talk a little bit about our organization in Trinidad and Tobago, what we've been doing in terms of nutrition, and what we've been doing in terms of our support groups. So the Diabetes Association of Trinidad and Tobago has been around for probably the last 35, 36 years. To date, we have about, well, in excess of 5,000 members who are distributed among our support groups or branches. So I have a little map up of our support groups in Trinidad and Tobago currently. We do have 22 support groups around the country. These groups are, well, we call them branches because they are support groups, but we do have a structure in place where they are, and they have their own local boards. So they have their own chairperson. One of the positions in the branch is a dietitian nutritionist. So there is a dietitian nutritionist volunteer in each of these branches who do provide nutritional services and support to the members. We are about to open a few more branches. As you could see, part of the country is not really covered, but of course, most of those are rural areas. We need to get into those areas some more. But we do have a very good spread, and we do have these meetings. So these meetings these support group meetings are, of course, once a month, but the group does meet quite often. Outside of that, of course, they do outreaches and activities around the areas. So it's about support, it's about education, it's about advocacy, and they also do screening in their community and outreaches in their community. A big part of the nutrition, or rather a big part of the education component, is nutrition, because we know that with diabetes, the challenge that most people have in management is mostly nutrition. Nutrition is one of the major, or rather proper nutrition management, or proper having proper meals or having balanced meals are one of the biggest limitations we've seen in people living with diabetes in Trinidad and Tobago, and I suspect, of course, it's around the world. So we do focus quite a lot on nutrition education at the branches. So at every meeting, a portion is dedicated to nutrition education. A portion is dedicated to, well, education, diabetes education in general. These tools, of course, are going to allow us to standardize what's happening across the country, because it's going to be able to put these guidelines in the hands of our nutritionists, and they're going to be able to now work with persons living with diabetes. Like Juanita, we are also training, we are going to be training 30 diabetes educators. We have been working with the Ministry of Health in Trinidad and Tobago to go into every single health center in Trinidad and Tobago. So while people are waiting to see their doctor at the primary healthcare centers, we're going to be having our diabetes educators, and of course, a portion of the education is going to be nutrition. So we're definitely going to be taking advantage of these tools, these guidelines, particularly those posters and those guidelines for people living with diabetes. What we've seen in terms of our, or rather, the needs of people living with diabetes, it's really around three main areas. People aren't sure about the choice of food. They aren't sure what they should be choosing. If you put two products next to each other on a shelf, they really don't know what they should choose, and most people don't, and they choose based on price. They choose based on what's most attractive, and that's why, as Fabio would have presented, the front of package labeling is so important. The second issue is people aren't sure or aren't able to know how to cook using healthy methods. The traditions, and I mean in Trinidad and Tobago, we have primarily an East Indian and Afro-Caribbean population, and tradition and traditional cooking is a big part of it. So cooking with a lot of oil and coconut oil, and cooking with a lot of margarine and vegetable shortening is the norm, and it's been passed on from generation to generation. So persons just know that's how you cook. So teaching about cooking and preparing foods are very important, and we have been doing that at the Diabetes Association Trinidad and Tobago. We've been working with our nutritionists to do cooking demonstrations for persons. But what's more important for us is intervention very early on, and intervention in children. So we do have 3 projects through which we do have intervention at different stages of life. We have our diabetes school quiz, which we've just completed, which contains diabetes nutritional education as part of the quiz, and that would have targeted standard 3s. So we did have over 600 standard 3 children participate over the last few months, and the quiz is being done across the region as well. There are 6 other Caribbean countries. I believe Juanita, Antigua included, is participating in that quiz. So that's one aspect. The other is, of course, our children with diabetes camps, and our children who are overweight and obese, or child lifestyle camp, where we teach them. Heavy component is teach them about nutrition, taking them to the supermarket, teaching them how to shop, teaching them how to cook the foods, and making it fun by making it into a competition. And the third age group is our secondary school students, which are through our 6th form internship program. And this is the 2nd year that we're doing it. We take 36 formers, and we teach them how to be health advocates. And they've started their youth arm, and now they're going into schools and they're advocating for us on behalf of people living with diabetes. And of course, they all want to be doctors, they all want to be health professionals. So getting that volunteerism spirit in them very early is very important to us. The third limitation, or rather the third problem that we've been seeing is, of course, people aren't sure about portions, about how to healthily portion their meals. And I see that the Caribbean plate is being used as one of the posters. Very important, because for a very long time, we've been depending on American or European images of the plate. So we're very happy to see that as well. And using these components that CARFA has put together, I think will definitely address these issues. We are going to be using it, and I know that it is going to be very beneficial for our members in Trinidad and Tobago and the other diabetes associations around the Caribbean. Thanks, Maisha.
Thank you, Andrew, and thank you, Juanita. And back to you, Ms. Caleb. Thank you for the opportunity to hear from the organizations working on the ground with people living with diabetes, really at the forefront and in the communities. Thanks again.
You're most welcome, Aisha, and I must thank you, Ms. James and Mr. Danu, for highlighting the important role of our diabetes associations in helping to manage diabetes. And I encourage all persons living with diabetes listening in either on Zoom or on YouTube to access those support services. I now have the pleasure of being your 4th and final panelist for today. As introduced at the beginning, my name is Abigail Caleb, and I am the Senior Technical Officer for Food Security and Nutrition at CARFA. My presentation will be done in 2 parts, followed by a video presentation. The first will be the findings from a needs assessment study that was carried out last year. The second will be the toolkit, the process for development, and the video will be on the toolkit itself. Now, both the toolkit and the needs assessment were a part of a larger project titled Needs Assessment of Nutrition Services and Support Tools for the Dissemination of the Nutritional Management Component of the CARFA Guidelines for the Management of Diabetes in Primary Care in the Caribbean. And The overall purpose of this project was to support the implementation of these clinical guidelines within our member states, with the expected outcome of having an improvement in public health nutrition programs that would then spill over into improved clinical as well as self-management of diabetes. As indicated, this first presentation will be findings and overview, a report of the needs assessment, the nutrition assessment of needs assessment of nutrition services. So the purpose of this study was to determine what is the current nutrition services available in primary care level in our member states in order to support diabetes management. There were 5 main objectives, among them included so to determine what were the nutrition services available, what were the level or is the level of competency of the healthcare professionals delivering those services, what tools do they use, what are the challenges that they're encountering, and what additional support, especially from our end at CARFA, is required. So we took several approaches in conducting this study. So initially we conducted a desk review of relevant documents and similar initiatives that would have been carried out regionally as well as internationally. So really looking for the best practices. Secondly, we consulted with key stakeholders within Ministry of Health, as well as persons with diabetes. This then led into the development of the proposal as well as the data collection instruments, which were then pre-tested. Once approved, the assessment was carried out, and this was done between July to December of last year. And the report was prepared, which is what I'm presenting on now. We used a convergent parallel mixed method study design where we combined both quantitative data and qualitative data to give an interpretation. We employed purposive sampling from a representative 10 of our 26 member states that are listed here. The target population included nutrition and dietetic professionals, other health professionals, and paraprofessionals, persons with diabetes above the age of 18, as well as their caregivers. For data collection for the quantitative aspect of the research, this was done using a self-administered electronic structured questionnaire. And as you can see here in the table on the slide, we had a total of 32 health workers participating across those 10 countries. Data collection for the qualitative aspect was done virtually via the conduct of 10 key informant interviews. These 10 interviews were not a part of the original set that would have completed the questionnaire. We also had focus group discussions with healthcare providers, also not a part of those that would have conducted the questionnaire, and focus group discussions with persons with diabetes. In analyzing the data, the quantitative and qualitative data were analyzed separately, and then the two merged and interpreted. Now, what I am presenting here as to the methodology of the study, it's, for the purpose of time, so that we're not here for the entire day, it's really an overview, but you can have access to the full report, of course. There was one significant limitation in conducting the study, and that was as it relates to pre-testing of the survey instruments. We were only able to have that done in one of our member states, right here in Trinidad. And I will now be focusing on pulling out some key findings or results from the needs assessment study. So first, we wanted to know what was the human resource available for nutrition counseling to persons with diabetes. As you can see here in the graph, most of the services are provided by registered dietitians, nutritionists, or public health nutritionists. followed by community nurses and physicians. Now, this is quite interesting considering that it is a well-known fact that there is a paucity of registered dietitians, nutritionists, and public health nutritionists within the region. We also wanted to know what was the level of training, specialized training in diabetes that these healthcare professionals would have received, including in-service training. A third of those surveyed had not received any specialized training in service or otherwise. In fact, none of the physicians that were a part of the study indicated that they received any in-service training to support their nutrition interactions with persons with diabetes. So this is quite telling. Thirdly, we wanted to know what were the nutrition services that are being provided. All right, so there are several of them. So just highlighting the top 5, we had nutrition counseling, nutrition education, meal planning, right here, nutrition screening, followed by nutrition assessment. And these activities were conducted by over 80% of survey participants, which you would think is a good thing, but not really, because depending on the level of training of the health professional, their competency level, the level of comfort with the topic, the depth at which these services were carried out from counseling to assessment, it varied greatly. In fact, when we did the focus group discussions with the persons with diabetes, they indicated that most of them were not referred to a dietitian for counseling. So we're talking about that specialized one-on-one counseling. They would have received information, yes, but how adaptable it was for them, that was a gray area. And there was one person in particular, so I did pulled out from the report that indicated that the doctor checked HbA1c, diagnosed the diabetes, and said to stop eating bread and rice and give metformin, and then sent them home. Now, as much as this is one quote I pulled out from the study, for those of us that were on the ground or are currently on the ground, we know that this is a reality. Right, there were those persons with diabetes in the study that indicated that upon diagnosis, they did not receive any nutrition education. It was tablets or medication and go home. Now, I'm not assigning blame, because if we look back at the slide in terms of the specialized training, so if I am not trained to do, then how effective am I going to be to deliver? These are just identifying the gaps. Fourthly, we looked at nutrition screening, and so the information in the graph here was garnered from the focus group discussions with healthcare professionals. So on a positive note, most persons with diabetes do receive some sort of nutrition screening upon diagnosis, some sort, so it varies, 96.9%. Tools, whether or not they're used, varies from 68.8% upon first visit or 59.4% upon subsequent visits. The tools that are used for screening, though, only about 50% or half of those tools would have been developed by ministries of health or approved by ministries of health. The remainder were either developed by nutritionists, dietitians, community nurses, doctors, other categories of health workers, and using information that they would have gotten from the internet. So the quality check and how, adaptable it was for the not just the region, but for the population, that calls into question. There were a smaller percentage, about 3% of the tools that were actually given to the professionals by food companies. And you know that when they do that, they have their branding on it, the branding that oftentimes contradict the message that you want to get out there, whether it be promoting formula over exclusive breastfeeding, or having foods that are high in fats, sugars, and sodium. So, I mean, while the tools themselves, I'm sure, were of good quality, healthcare professionals, you really need to be careful of what we accept from food companies in terms of how it can contradict the message that we're giving to our patients. Also as it relates to nutrition screening, so the findings in most cases, 96.9% were used to help the persons with diabetes. So either in referring them for further care, for instance, a nutritionist or dietitian where they were available, or to help to guide them to self-manage or just to monitor their management. So that was good. Follow-up activities were conducted in most instances, and 71.9% of health professionals reported that they would have assessed readiness for change in the person with diabetes. However, this was not structured, and it was oftentimes subjective than objective. Fifthly, so we looked at patient education, and here we looked at different aspects of patient education. So first, the frequency. So whether it was in the form of group education or individual sessions. Most times, education sessions were carried out monthly, so once a month, 34.4%, followed by weekly, 12.5%. Noteworthy, though, is this 21.9% of health workers that reported never conducting group or individual education sessions. We wanted to know on the patient education, what were the topics that were covered? So we have here a nice range. So 13 of them made the top 10. Right? So among the topics most addressed were portions, balanced diet, dietary fiber, foods that can be eaten, sugars in the diet, fat in the diet. Once more, to varying degrees depending on the level of expertise and comfort of the health professional. However, there appears to be little discussion on the fact that the entire family can eat the same thing, and to assure the person with diabetes that there's no such thing as a diabetic diet. So we see here the lowest performing in terms of the topics covered, so 37.5% as it relates to my food, family food, in that I can eat from the family pot, just making some slight modifications in terms of portions, for instance, more vegetables and peas, less rice and flour or starchy foods. So there was less information on that given. And also 46.9%, all foods can fit, but in that they can have the variety of foods from the 6 food groups, but moderation is the key. So in getting that message across, so those two are the least performing indicators. Still on patient education, we also wanted to know what were the tools used. So our top 5 tools more commonly used were flashcards, handouts, brochures, food models, and diabetes guidelines. The challenge, though, is that some of these tools were outdated, that they were not culturally appropriate. Some were just not attractive. Some tools would have been in existence for a number of years, and through repeated photocopying, the printing is faded, they were difficult to read, and so not really useful or used much by the person with diabetes. And then there were some tools that weren't suitable for varying literacy levels. So taking all of this into consideration, actually we're already forming the conclusion that as it relates to patient education, perhaps it is not adequate. And that is exactly what both the healthcare professionals, 78.1% of the healthcare professionals and persons with diabetes felt, that it was not adequate. Moving on to our Sixth finding, challenges encountered, right? So the most common challenges mentioned, just focusing on the top three here, were lack of insufficient resources, insufficient staff, and poor infrastructure. Now, for those of us who have been or are currently on the ground, we know that this speaks true across most, if not all, of our member states in terms of the human resource we have for nutrition, counseling, and education, especially for diabetes. And for those nutritionists, dietitians, the infrastructure or the space that is available for individual counseling sessions and also to conduct food demonstrations, which was they didn't make it into this table, but the need or the request for demand of demonstrations came out of the focus group discussion with persons with diabetes. We then asked or wanted to find out, rather than making assumptions, what were the required resources for implementation. More than 50% of healthcare workers indicated flashcards, booklets, food models, videos, and posters. So we're seeing here, this is kind of like shaping the whys of this toolkit, why it was developed. Oh, just also to add that, so what is here reflected here is from the focus group discussion and the interviews, the surveys with healthcare professionals. But one key thing that came out of the focus group discussion with persons with diabetes is that they needed to have more handouts on what was discussed and with them at the counseling sessions, as well as information and psychological effects of the disease. So just something to note. And finally, the eighth aspect I'll present on from the finding are recommendations to improvement. So these two tables reflect a combination of feedback we would have gotten both from healthcare professionals and the persons with diabetes for effective self-management. So there are 6 headings. I'm just going to highlight 1 or 2 on each of them. So for improvement in nutrition screening and counseling sessions, what was requested was to have guidelines for educators and screening tools. And we heard you. And these were addressed in the toolkit for healthcare professionals. Education materials, there was a request to have more resources such as brochures, posters, and videos. The toolkit once again speaks for itself, even though it does not contain videos, but one step at a time. Food demonstrations, the need for this, and more so to have a designated space to have it done. I always say to my students that food and nutrition is something that you taste, you don't just hear. So when I'm speaking about low fat, low salt, low sodium recipes, I mean, what does that mean? But when I taste it, how I can adopt my local recipes that are available to suit my health and nutrition needs. I mean, light bulb goes off. It's in the taste. So there really is need for that. On the nutrition competencies, so there are recommendations for additional human resource. Unfortunately, we cannot address that in terms of hiring staff, but what we can do is aid in capacity building through training. So providing the tools as well as providing the training to our member states. And there was a request specifically for the non-nutrition dietetic professionals that found themselves having to offer nutrition, education, and counseling services. On the physical facilities, so dietitians, would like to have a designated space for teaching and learning, specifically to conduct individual sessions. And just general recommendations were to have nutrition services be accessed at all of the health centers across country. So Once again, not something we can address, but we can certainly advocate for it. And just, so there's quite a bit that I said, but just to, just to highlight the main takeaways from the findings. So there are limited human resource capacity in countries. There is inadequate specialized or in-service training. There is unstructured nutrition screening. There is inadequate and insufficient nutritional support tools. There is a demand for food demonstrations, and there is inadequate space for individual counseling sessions. Now, nutritional services are offered to persons with diabetes, not just for the sake of it, just to check a box, but it has a purpose towards helping them to effectively self-manage. And notice that I keep mentioning the word self because it's about, empowering them to be able to make the necessary choices for themselves. But you need to do the empowering part. And that calls for a comprehensive approach. If the implementation of the CARFA clinical diabetes guidelines are to be successful, or any clinical guidelines, if you are not currently using our guidelines, if they are to be successful, the challenges that were highlighted from the needs assessment study, they would need to be addressed. So from our end, we would have developed a diabetes nutritional management toolkit, as well as an implementation and monitoring and an evaluation plan for its dissemination to countries in the Caribbean. And today's launch of the toolkit is the first step forward towards a positive direction. This then leads me into the second and very brief presentation of the toolkit. An overview of the process for development of it. Yeah. So, overview of the process for the development of the Diabetes Nutritional Management Toolkit. The main purpose of the toolkit was to support the dissemination of the nutrition management component of the clinical modules. Dr. Armstrong would have presented on those 5 modules. We know that 2 of them, modules 2 and 3, speak more specifically to diet and lifestyle management. So having tools in place to support the implementation of that. And the main objective was to standardize the nutritional management of diabetes at country level and regionally. In developing the toolkit, so I've summarized the procedure into 8 steps. Step 1, we did an extensive review of the CARFA guidelines, not just modules 2 and 3 that focus specifically on diet and lifestyle, but as well as modules 1, 4, and 5 for any relevant nutritional management suggestions. Step 2, we then did a literature review. So, to find out what was the current evidence on what works. And we also conducted consultations with health professionals and nutrition and dietetic experts or professionals within the region. This then led to step 3, the development of a draft list of support tools. Now, decided best to have tools that can be used both by healthcare professionals and persons with diabetes, but then also to have tools that were specific to both groups. And that is what we did. Now, please note that even though we have tools developed for persons with diabetes, as well as their caregivers, it in no way should be a replacement for specialized professional services of nutritionists and dietitians. Just to have that disclaimer out there. So after we developed that draft list and finalized it, step 4, we developed the support tools in which at this point we engaged a graphic artist. Step 5, we pre-tested the support tools. So this was a limitation in another limitation in this aspect of the study, in that the tools were pre-tested with nutrition and dietetic professionals who provide support services to persons with diabetes. So we did not, it was not feasible, it was not possible to pretest with persons with diabetes at the time, because we were working with a very strict, tight deadline. But we use different levels of nutrition dietetic professionals with different levels of training. Yeah. Step 6, after pretesting, we edited and finalized the support tools. Now, we didn't just leave it there, having the toolkit, but step 7, we prepared an implementation plan and monitoring and evaluation plan to ensure the dissemination of the tools. And step 8, dissemination of the tools, and this launch is why we're here. These are the list of the tools. There are 6 of them in all, comprising the Diabetes Nutritional Management Toolkit. Not going to read this. There is a video that is going to properly introduce the tools, but just to note that we have 2 booklets, one for healthcare professionals, one for persons with diabetes. We have 3 posters and 1 handout. And before I show the video, just as it relates to the implementation and monitoring and evaluation plan, so just a point to note, it was developed so as to not just facilitate the use of the tools, but the standardized use of the tools. Having all health workers, whether you are nutritionist, dietitian, or not, be able to say or provide the same messages to persons with diabetes. And this is just a screenshot of the content of the plan, right? But within it, there are indicators to track progress, as well as the necessary activities such as training to support implementation. And this now brings me to the reason why we are all here, to have sight and use of the Diabetes Nutritional Management Toolkit. And I thought it best to have this done not through a PowerPoint presentation, but rather through a video presentation, which we will now share with you. The video on the toolkit, please. Okay, so we're having some technical difficulties, but I do have it queued up. So I will go ahead and share.
CARFA is the sole public health agency for the Caribbean, mandated to build member states' capacity to prevent disease.
Just doing a check. So can one of the panelists indicate that you are both seeing and hearing the video?
Yes.
Okay, great. Thank you.
CARFA is the sole public health agency for the Caribbean, mandated to build member states' capacity to prevent disease and promote health and wellness through leadership, partnership, and innovation in public health. In 2019, to strengthen and standardize the management of diabetes, CARFA launched an updated version of the CARFA guidelines for the management of diabetes in primary care in the Caribbean. The clinical guidelines are presented in 5 modules. In 2022, following a needs assessment study in 10 member states, CARFA developed nutritional tools to support the implementation of the nutrition component of the CARFA clinical diabetes guidelines. The 6 tools comprising the Diabetes Nutritional Management Toolkit will standardize the nutritional management of diabetes in the Caribbean. The Care Guide for Persons with Diabetes booklet contains basic information on diabetes. Information is presented in a simplified and mostly pictorial form on the concept, types, risk factors, signs and symptoms, complications, and management of diabetes. This booklet also contains recipes from CARFA member states. The target audience is persons with diabetes and their caregivers. The Healthcare Professionals Guide booklet contains information for the healthcare professional on a range of topics, including 1. Selected nutrition intervention strategies such as counseling, group education, meal planning, reading food labels, and portion and serving sizes. 2. Physical activity recommendations for children, adolescents, adults, and the elderly. And thirdly, self-management. The booklet also contains sample meal plans and menus. The Managing My Diabetes poster highlights the key ways to manage diabetes. These are a healthy diet, physical activity, medication, self-monitoring of blood glucose, and routine visits to the doctor or healthcare team. The target audience for this poster is healthcare professionals and persons with diabetes and their caregivers. The My Caribbean Plate poster represents the Caribbean version of the American My Plate for persons with diabetes. It displays foods or food groups that are locally available in CARFA member states in the recommended proportions. The target audience for this poster is healthcare professionals and persons with diabetes and their caregivers. The Nutrition Labels Made Simple poster presents a guide to reading and understanding the nutrition facts panel on food containers. The poster also draws attention to the octagon-shaped front of package warning labels on some food containers to more easily and accurately identify foods that are high in sugar, fats, saturated fats, trans fats, and sodium. The target audience for this poster is healthcare professionals and persons with diabetes and their caregivers. The Healthy Eating with Diabetes brochure contains recipes from CARFA member states and a sample meal plan for an 1800 kilocalorie diet. But please note that meal plans for persons with diabetes should be calculated based on individual need. The Diabetes Nutritional Management Toolkit is expected to be a major support to all healthcare professionals involved in the management of diabetes in the Caribbean. It is also expected to help to address the challenge of limited human resources and the lack of appropriate standardized support tools in providing services to persons with diabetes. These tools allow them to effectively self-manage their conditions.
And there we have it, our toolkit. You've now heard from us, the panelists, representatives from PAHO, Healthy Caribbean Coalition, the Diabetes Association of Antigua and Barbuda, as well as Trinidad and Tobago, and us at CARFA. We've presented on the problem and provided tools to help to solve them. Presentations were made on nutrition and NCDs in the Caribbean, the CARFA Clinical Diabetes Guidelines, diabetes support groups, and we have just unveiled the Nutritional Management Toolkit. I now invite questions and feedback from the audience. Once again, you can place your questions in the Q&A function, which can be found at the bottom of your screen. And I note that there are already some questions that were placed in the chat. Some were already responded to by our panelists. Let me just see if there are any others to be addressed. So 7 questions were addressed by our panelists. Okay, so copy of the booklet So it's available on the CARFA website, but I will also put the link in the chat, which I am doing now. So I'm putting a link to our Facebook page, sorry, to our website, where you can access the link, and then a second link where you can access it directly. Will there be a presentation on type 2 diabetes amputation prevention? Unfortunately, not today, but certainly something we can take into consideration for future webinars. How many healthcare providers and diabetic educators do the 60-second diabetic foot exam? Almost none. I believe this is more of a comment. Just okay, so this is a comment from one of our participants that would like to see more preventative measures being taken to prevent amputation, such as implementing the 60-second diabetic foot exam, which I fully agree with. Yeah. We have another comment from a panelist, so not a question. As it relates to the paucity of human resource capacity. And yes, for effective management of diabetes, medical nutrition therapy is required. So the question here would be, is there any plan to support training of dietitians or nutritionists? Training available at UE Cavehill campus, yes. So there is training programs available at the diploma and degree levels at the University of the West Indies. One of the plans that we hope to implement, not that we're starting with immediately, but one of the plans we hope to implement is to see how we can, I should say, influence the curricula at academic institutions. I personally am a part-time lecturer at one of the universities, and I can speak to the very limited time that is allocated for human nutrition in the curriculum of medical professionals. And I have to really try to find a way of, incorporating more things within the time, videos, having seminars, whatnot. But that is certainly one thing that we're looking at. And another comment, that we cannot rightfully expect physicians and nurses to do the job of dietitians and nutritionists. I fully agree with that. And we do not expect that, but what we would like to have is for some form of nutrition education to be carried out and for it to be accurate, which the toolkit will assist with. Someone has asked, can we see a slide on how to properly portion food according to age range? So that is referring to the booklet. So you can access the booklet. The links have been placed in the chat. And we have here another comment. So I believe this person is asking for action on the part of healthcare professionals rather than talk. So you walk the walk and not just talk the talk. Fully agree with you. But that's not something, that's something that we can advocate for, but we can't guarantee, none of us can. There's another question, will CNAs be provided for this webinar? Unfortunately not. So for that, I take the blame. In planning the webinar, I must say that we at CARFA really did not expect to have such a high turnout and for there to be so much interest generated. But certainly for future webinars, we will, to have your credits awarded, we'll certainly look into that. And there's a final question here. How user-friendly is this toolkit? So for this first participant, I will let you be the judge of that after you would have reviewed it. And those are the questions in the Q&A. As indicated, 7 questions were already responded to. Let me see if there are any participants that have their hands up. Perhaps they would, oh yes, we have 2 attendees that would like to voice their questions. So we have 3 persons. I don't know, so IT support team, if you can unmute 1 at a time. We have 3 hands up. We have Yvette, Curtius, Akila Matthew, and Roshana Seeley. Can either of you try unmuting your microphones from your end and see if that works? If not, you may have to type your questions in the chat, unfortunately, in the Q&A function rather. Okay, so while that is sorted out, there's another question here. Will printed versions of the posters and booklets be available? Yes, but not immediately. But we didn't want to wait until that entire process is completed to, have the launch and dissemination. I mean, work can start with the soft copy. So, Let me see, any other questions? Okay, I am told by IT support team that you are able, Miss Yvette, Akila, and Roshana to unmute yourselves. So can you please try again? Let me continue to go through the chat. I see there are some additional questions and comments here. Is there a certificate at the end of this session? Yes. So once you would have registered, how do we deal with persons who are fixed on taking herbal medicines rather than pharmaceuticals? So this is, the thing is, the most that we can do is advise, but we cannot make persons do or not do, right? So, but it would require a bit of effort on our part in terms of helping to convince them. So finding these, so don't just say don't do, but don't do because why? So finding from the literature, what are the interactions with the substances in the herbal medicines, or bush, as we say in some countries, with the medications that they're using? What are the possible short and long-term effects, right? So when you're speaking, it's not just from doesn't come off as it's just your opinion or belief you're trying to instill, but this is what the science is showing. Another question on the certificate, yes. So there is a suggestion here for the Healthy Caribbean Coalition. Can we have a Caribbean platform for the diabetes organization to empower and strengthen outreach and community engagement?
Ms. Kayla, did you want me to answer that?
If you're able to, yes.
Sure. So we actually do have the overall network, and we've been working with the members to try and revitalize the kind of sub-network of diabetes organizations. So that will be a priority for us over the coming year. Thank you.
Thank you. Another question, what strategies can be utilized to remove the myth that a healthy diet does not mean expensive? For instance, peas, legumes, etc. are very inexpensive. So this too requires effort in our parts. So one of the things that I always encourage is, so to advise on nutrition, you don't need to be a nutritionist or a dietitian or even know how to cook, but you need to know what is locally available. So for instance, what are the fruits and vegetables that are in season and perhaps are more affordable? You yourself may not be the ones preparing the meal, but you can certainly, interact with persons who go to the markets, or even you yourselves go. So when you are advising on have this instead of that, you can attach a cost benefit aspect of your counseling. So that's something that we can certainly try to do, and it will take time. But we start one person at a time. So there is a question for, oh, okay, so someone would like to know how they can become a member of CARFA. So CARFA it's a public health agency. So you can think of it as the regional version of your local Ministry of Health. But if you are so there's an interest in nutrition. If you are a registered nutritionist or dietitian, then you can make an application to the Human Resource Department of the Caribbean Public Health Agency. You can access that information on our website as to where to send your application with CV. Okay, so I really need to wrap up. So we just have a couple more questions here. Will the video be circulated? Yes, it will be available on YouTube as well as a Facebook page. Okay, there's a nice suggestion here for the Caribbean to institute a no sugar month. Something to consider, but I would go a step further and not just say a no sugar, but where we highlight the unhealthy ingredients in food, sugars, fats, especially saturated and trans, and sodium. Okay, and so we really need to wrap up now. So there are several other questions on the toolkit itself. Oh, I'll take one more question. So this was from someone on YouTube. Which universities in the Caribbean can we access training in diabetes management? Does anyone on the panelists have any insight in this besides University of the West Indies? What about the Southern Caribbean? Aisha, anything to add? Okay, so yeah, I think those are it. University of the Southern Caribbean and University of the West Indies. Okay. So no, the questions, I know that there were some other questions that were placed in the Q&A as it relates to the booklet, the tools that were presented. So you have access to the tools, and if you have any questions that you feel need to be addressed after reviewing those tools, you can send an email through the same link where you would have received your registration details. And I'm now going to hand the baton over to Dr. Armstrong, who is the head of the Chronic Diseases and Injury Department at CARFA, to bring this webinar to a close.
Thank you, Ms. Caleb. And ladies and gentlemen, we have reached the end of our webinar after stimulating discussion on the nutritional management of type 2 diabetes. The webinar has provided us with plenty of ideas and information, resources, and visions to reflect upon, and also an opportunity for us to come together to learn more about the work being done to address the impact of NCDs from a whole of society perspective. And of course, the introduction of the Diabetes Nutritional Management Toolkit. I wish to thank our speakers whose presence has been invaluable in making the webinar a success. And of course, you, the participants, as without your participation, our goal of launching the Nutritional Management Toolkit would not have been realized. As you heard before, over 900 persons would have registered for the webinar, and we had over 700 persons participating between Zoom and the YouTube live stream, signaling the interest in the resources that can improve nutritional management for diabetes. I also wish to thank the CARFA team for hosting and organizing this event, the departments who coordinated and worked together to implement the webinar. And of course, we look forward to you accessing and using the toolkit across the Caribbean region as we work together to reduce the impact of NCDs on our regional population and achieve the vision of healthy people, healthy spaces, and a healthy Caribbean. Thank you, and enjoy the rest of your day.
And just one final thing to note. So there's a short webinar feedback survey. We would appreciate your feedback. Should we repeat this webinar to know what are some things that we can improve upon? So please access the survey via the link that was placed in the chat. Thank you. Oh, I need to send this link to YouTube. Are we still live?
We still have persons on the
Okay.
link.